Hello, welcome to the City of Dallas 2021 Open Enrollment Benefit Presentation. Open enrollment for active employees is scheduled September 14th through September 27th. Please note that this is an active enrollment, which means you must actively enroll in benefits in order to have coverage for the 2021 year. If you do not enroll, your current benefit elections will end on December 31st. Remember, if you choose to waive coverage, do so through EBC. If you do not enroll or waive coverage through EBC, the city will assume that you do not want coverage for the 2021 plan year. As a reminder, open enrollment is the only time of year that you can make changes to your coverage without experiencing a qualifying life event. Examples of qualified life events include birth, adoption, marriage, divorce, or loss of coverage. It's important to note that any changes to your benefit elections must be made within 31 days of the date of the qualifying life event. How do I enroll? You have two ways to enroll in your 2021 benefit elections. You can enroll online with EBC using the exact address shown here. Please note that this address is also noted in your 2021 benefit guide. Please log into the online system using your username. Your username is your first name, last name, and your 4-digit birth year. For example, if your name is John Smith and you were born in 1966, your username would be john.smith1966. Your PIN is 6 digits, composed of the last 4 digits of your Social Security number and the last 2 digits of your year of birth. For example, if the last 4 digits of your Social Security number are 1234 and you were born in 1966, your PIN would be 123466. Please note that you will be asked to change your PIN after you log in for the first time. Be sure to make note of your new password for future use. If you have logged into the EBC system previously, you will use those credentials to access the system. If you have trouble accessing the system, please contact EBC at 214-556-0971. Please note that this number can also be found in the 2021 Benefit Enrollment Guide. You may also choose to enroll via phone using an EBC benefit specialist. To enroll with the support of a specialist, please contact EBC during open enrollment. As a reminder, open enrollment begins on September 14th and will conclude on September 27th. What do I need to enroll? Supporting documentation is required if you are adding an eligible dependent who is not currently covered by a City of Dallas plan. Supporting documentation must be sent in one of the 4 ways noted below. Your documentation can be uploaded from your computer using the online enrollment process. Please be sure to follow the on-screen instruction. You may also send it from your smartphone using the MySolarics app. Documentation may also be emailed to your enrollment at ebcoh.com or faxed to 513-371-5559. Examples of supporting documentation include a marriage license, birth certificate, or any other document that can be used to verify your relationship to the eligible dependent. If you have questions about supporting documentation required, please contact EBC at 214-556-0971. They will be available beginning Monday, September 14th from 8:15 a.m. to 5:15 p.m. Monday through Friday, Central Standard Time. The City of Dallas is proud to announce a new partnership with Blue Cross Blue Shield of Texas for all medical plans beginning January 1st of 2021. Why Blue Cross Blue Shield of Texas? Blue Cross has the greatest distinction of network options of all major carriers. The city has selected 2 of the finest Blue Cross Blue Shield network options for its 2021 medical plan offerings. You will have the choice between 2 network options for 2021. The first option will be the Blue Essentials Network. This is a narrow HMO-based network available to Texas residents only. Your second option will be the Blue Choice Network. The Blue Choice Network will be available if you elect the copay plan or the HSA plan. The Blue Choice Network is a PPO-based network. The city also selected Blue Cross Blue Shield because of their increased provider access and their ability to enhance the wellness and clinical resources available to all City of Dallas employees. In looking at the network options available, Blue Choice. The Blue Cross Blue Shield Blue Choice Network is a broad-based PPO network. The Blue Essentials Network is a narrow targeted network available to Texas residents only. The Blue Choice Copay Plan and the Blue Choice HSA plans both will continue to include the Enhanced Benefit Tier. As a reminder, the Enhanced Benefit Tier pays 90% of your facility charges for all services rendered at a Baylor or Methodist Health System facility. Please be sure to confirm that your doctor is in one of the networks available for 2021. Again, you should look for the Blue Choice Broad-Based PPO Network or the Blue Essentials HMO Network. To locate providers, go to www.bcbstx.com and click on the blue Find a Doctor box in the middle portion of the screen. Next, click on Search as Guest, then click Search in-network providers. Be sure to answer the questions on the screen. This will support you in locating providers that are in either the Blue Choice Network or the Blue Essentials Network. Next, we'll transition to looking at the 3 medical plans being offered for 2021. The first plan is the Blue Essentials PCP plan. PCP stands for Primary Care Physician. Because this plan is a Blue Essentials Network plan, you will be required to designate a primary care physician at the time of enrollment. This plan is only available to those who reside in the state of Texas. This plan also requires a referral for all specialty services. The individual deductible for the PCP plan is $1,500 with a family deductible of $3,000. The annual out-of-pocket maximum is $6,350, and for family it's $12,700. Please note that the annual out-of-pocket maximum is the exact out-of-pocket maximum currently in place today across all City of Dallas medical plans. Preventive care will be covered at 100%. Primary care physician visits are available at a $25 copay. With the referral for specialty care, the specialist office visit copay is $50. Lab and x-rays are also a $25 copay or $50 copay. Urgent care is available at a $40 copay, and emergency room services have a $300 copay plus a 20% deductible amount. Inpatient, hospital care, and outpatient surgery are also available at 20% coinsurance after deductible. The next medical plan available is the Blue Choice Copay Plan. The Blue Choice Copay Plan is on the Blue Choice PPO network. This is the broad-based Blue Cross Blue Shield network. There are no referrals required for specialty care, and there is no requirement to designate a primary care physician. The deductible is $1,500 for an individual and $3,000 for family. And the out-of-pocket maximum is $6,350 for individual, $12,700 for family. Preventive care is covered at 100%. Primary care physician visits are $25 and specialty visits are $50. Again, no referral required for specialists on the Blue Choice broad-based copay plan. Urgent care is $40. Emergency care is a $300 copay plus 20% after deductible, and inpatient and outpatient procedures are available at 20% after deductible. Please note that the plan design for the Blue Choice broad-based copay plan and the plan design for the Blue Essentials narrow HMO network are exactly the same. The difference between these two plans is provider choice and network choice. If you'd like the larger network, that would be the Blue Choice copay plan. If you are comfortable with the narrow, high-performance targeted network, that would be the Blue Essentials PCP plan. The third plan option is the Blue Choice HSA plan. Please note that this is a high deductible health plan on the Blue Choice broad-based network. The plan has an annual individual deductible of $3,000, family deductible of $6,000, annual out-of-pocket maximums are set at $6,350 for an individual and $12,700 for family. As a reminder, all City of Dallas medical plans have the exact same out-of-pocket maximum. Preventive care on the HSA plan will be covered at 100%. All additional services on the high deductible HSA plan are subject to deductible. Once the deductible is satisfied, your portion is 20%. Please note that the City of Dallas will continue to contribute to the HSA plans for 2021. If you elect individual coverage, the city will contribute $700 to your HSA plan. If you elect any dependent level coverage includes employee plus spouse, employee plus child, or family coverage. The city will contribute $1,700 to your health savings account. Active employee contributions. This slide looks at the rates or the per paycheck amounts for all active employees. Please note that the Blue Essentials PCP plan and the Blue Choice Copay plan are both salary banded tiers. There are 3 tiers. Tier 1 would be individuals who earn less than $44,000 annually. Tier 2 are individuals earning between $44,000 and $66,000 annually. Tier 3 would be individuals earning more than $66,000 per year. The Blue Choice HSA plan is not salary banded. Therefore, the rates shown are applicable to all employees. The per paycheck deduction amounts will be taken from 24 of your 26 paychecks. Next, we'll transition to pharmacy benefits. Prime Therapeutics is the pharmacy benefit manager for Blue Cross Blue Shield of Texas. 30-day retail prescriptions for those on the Blue Essentials PCP plan and those on the Blue Choice Copay plan will be based on tiers. There are 3 tiers. Generic medications are available at a $15 copay. Preferred brand name medications have a $40 copay, and non-preferred brand medications have a $75 copay. It is important to note that these copay amounts are the same as the existing plan year. The Blue Choice HSA plan, pharmacy benefits are payable once you satisfy your deductible. Your portion is 20%. Additional benefits to keep in mind. Free diabetes and hypertension medications are available for certain drug classes if you are in the Blue Essentials PCP plan or the Blue Choice Copay plan. For those of you who elect the Blue Choice HSA plan, there is a preventive drug therapy list that offers reduced costs for certain generic preventive medications. Please also note that mail order is available and recommended for all maintenance medications. We will now transition to pre-tax savings accounts. Health savings accounts for the 2021 plan year will be administered by HSA Bank. Please note, you may only open an HSA account with the city if you are enrolled in the high deductible health plan. Please note that HSAs have annual IRS contribution maximums. Employee-only coverage and a high deductible health plan allows you to contribute up to $3,600 annually. Because the city will contribute $700 to your employee-only HSA, your maximum contribution is $2,900. If you elect dependent level coverage, the IRS maximum is $7,200. The city contribution is $1,700, which means your maximum contribution amount is $5,500 for the year. Catch-up contributions are available for everyone who is over age 55. The eligible catch-up contribution amount is $1,000. To be eligible for a City of Dallas Health Savings account, as a reminder, you must first participate in the Blue Cross Blue Shield Blue Choice HSA plan, which is an IRS qualifying high deductible health plan. You cannot be entitled to benefits under Medicare or double covered under any other medical plan. You or your spouse cannot be enrolled in a medical flexible spending account. You can, however, participate in a limited purpose flexible spending account, which is for dental and vision expenses only. You also cannot be claimed as a dependent on another person's tax return. Please note that if you are currently enrolled in a medical FSA today and plan to elect the Blue Choice HSA plan for 2021, you must completely exhaust all funds in your medical FSA account by December 31st. Failure to exhaust those funds by December 31st will result in you being ineligible to participate in an HSA. We will now look at flexible spending accounts, also commonly known as FSAs. All FSAs will be administered by HSA Bank for the 2021 plan year. There are 3 FSA options available. The first is a limited purpose FSA. Limited purpose FSAs are available to those who elect the Blue Choice HSA. If you elect the Blue Choice HSA medical plan, you are allowed to participate in a limited purpose FSA, which allows you to set aside pre-tax dollars up to $2,750 per year for eligible dental and vision expenses. It is important to note that limited purpose FSA dollars cannot be used for medical or pharmacy. Eligible expenses for a limited purpose FSA include dental and vision expenses only, things not covered by insurance. With all FSAs, it is important that you budget accordingly, as funds will not roll over year to year. FSAs are use it or lose it accounts. You must exhaust all funds in your FSA by the end of the grace period, which is March 15th, 2021. The second FSA type is a medical FSA. You are eligible to participate in the medical FSA if you select the Blue Choice Copay Plan or the Blue Essentials PCP plan. Medical FSAs allow you to set aside pre-tax dollars for eligible expenses in the amount up to $2,750 per year. Eligible medical FSA expenses include prescriptions, deductibles, co-pays, co-insurance, and certain over-the-counter medications which have a doctor's prescription. Medical FSA funds do not roll over. They too are use it or lose it, so please budget accordingly, and remember you must exhaust your funds by the conclusion of the grace period, which is also March 15th of 2021 for a medical FSA. If you are participating in a medical or limited purpose FSA today, it is important to note that you must re-elect coverage for 2021, as these amounts are not allowed to carry over. The third type of flexible spending account is a dependent care FSA. Dependent care FSAs allow you to set aside pre-tax dollars to pay for daycare for children under the age of 13 and eligible elder care expenses for seniors or adults residing in your home who need supervision during the day when you may be at work. You are allowed to contribute up to $5,000 in your dependent care FSA account, or $2,500 if you are married and filing a separate return. Please note that you cannot use dependent care FSA expenses for summer camps or long-term care of your parents that may be living in a nursing or rehabilitative facility. Dependent care funds also do not roll over. However, these funds must be exhausted by December 31st of 2021. If you have an HSA, you can contribute to a dependent care FSA account because you are covering expenses for elders or children, not medical expenses. Dependent care reimbursement must be submitted online or via a claim form. Dental and vision benefits. The city is also proud to announce that you have a new dental carrier for the 2021 plan year. Delta Dental will be the new carrier, and we are offering 2 new benefit plans for dental. Davis Vision will remain the vision provider for 2021, but you will have 2 new vision plan options. In transitioning to dental, please note that the new dental carrier for 2021 is Delta Dental. You'll have 2 dental plan options for 2021. The first option is a dental PPO plan. As a reminder, PPO plans allow you both in and out of network benefits. For the Delta PPO plan, you'll have a $1,750 calendar year maximum, a $50 deductible per person that maxes at $150. All preventive services on the PPO plan will be covered at 100%, while basic services are covered at 80% after deductible. Examples of basic services include fillings, extractions, anesthesia, and non-surgical periodontic work. Major services are covered under the PPO plan at 50% after deductible, and examples of major service work includes crowns, dentures, bridges, endodontic work, and surgical periodontal work. The dental PPO plan also covers orthodontia for adults and children at a 50% benefit amount, with a separate orthodontia maximum of $1,750. The second type of dental plan offered for 2021 is a dental HMO plan. Please note that the dental HMO plan is a managed care plan with a restricted network of providers. Only services provided by a DHMO provider are covered. You must also designate a DHMO provider at the time of election. Failure to elect a provider will leave you with no dental coverage outside of emergency until a DHMO provider has been selected. DHMO benefits do not include a calendar year maximum, so there are unlimited services and there are co-pays for all dental procedures. Please check the city's website for a listing of the DHMO managed care expenses, and you may also contact EBC if you have questions about the dental HMO schedule. Vision coverage. Vision is provided by Davis Vision, and you will have 2 plan options for the 2021 plan year. The first option is the High Plan, which is a 2-pair benefit. This benefit allows you to have 2 pairs of glasses or to mix and match. An eye exam is available at a $10 copay. If you choose retinal imaging, it is available at a $39 copay. There's a $150 allowance plus 20% off the balance on the High Plan. The lens benefit for single, bifocal, trifocal, and lenticular lenses is a $10 copay. The balance will be covered in full. The contact lens allowance on the High Plan is $130 plus 15% off the additional balance, and the frequency for frames, lenses, and exams is once per year. The Low Vision Plan works very similarly as the High Vision Plan. The exams and retinal imaging costs are the same. The frame allowance is $140 plus the 20% off. The lens benefit is a $20 copay for single, bifocal, trifocal, and lenticular. And then there's a $20 copay on your contact lenses with the exact same retail allowance. This plan allows you to have exam frames and contact lenses once per year, once every January. Important notes is that you have access to free frames at all Vision Works stores. This does exclude Maui Jim. You also have in-network benefits available to you online at glasses.com, 1-800-CONTACTS, and BeFitting. To locate a provider, we ask that you go to the Davis Vision website and remember to enter your client code. If you select the high plan, your client code is 7955, and if you select the low plan, your plan code is 9573. Please note that this information is included in your 2021 benefit enrollment guide. The next slide looks at dental and vision rates. It is important to note that dental and vision rates are not salary banded. The rates you see are applicable for all salary bands. The per paycheck amounts are also deducted for 24 out of 26 paychecks. And these notes are noted in your 2021 benefit enrollment guide. Next, we'll transition to value-added benefits, which are available to you at no cost. If we look at the benefits offered by Blue Cross Blue Shield, and we continue to add supporting information around the choice and the decision to move to Blue Cross. The Blue 365 program was a key decision maker for the City of Dallas. This is a discount program offered by Blue Cross Blue Shield, which allows you to have discounts for apparel and footwear, fitness, hearing and vision services, home and family services, nutrition, and personal care. To access Blue 365, follow the link on this slide. Another great benefit of transitioning to Blue Cross Blue Shield of Texas is the Benefit Value Advisor. Benefit Value Advisors, or BVAs, can help you save money on health procedures and tests. They can also help you understand and navigate your benefits more wisely. BVAs will offer support in helping you maximize the value of the benefit plans being offered to you. They can support you with getting cost estimates for various providers and procedures. They schedule appointments, they help you locate doctors or facilities, and they also support with obtaining pre-authorization for services. The Blue Cross Member Rewards Program. This program is administered by Sapphire Digital and offers you cash rewards when you select a lower cost, higher quality provider. How does it work? When your doctor recommends a treatment or a specific procedure, simply call your Benefit Value Advisor. Call your BVA at the number on the back of your member ID card, or log into Blue Access for members and click on the Doctors and Hospital tab. Find a doctor. Choose a Member Rewards eligible location, and you earn your cash reward. Just that simple. Please stay tuned. There will be much more information coming your way about the benefits of Blue Cross Blue Shield membership. Next, we'll look at the EAP services. Our new provider for 2021 is Magellan Healthcare. Magellan will offer 24/7, 365 days a year service to all City of Dallas employees and family members. As a reminder, the Employee Assistance Program is available to support us with complex issues in life. They offer a variety of resources and tools that can help us in our everyday life as well as in our work life. To get started or to reach out to Magellan for EAP services, please give us a call. Use the number on this slide. Please note the Magellan contact information is also noted in your benefit enrollment guide. You can access Magellan services via phone or email. CareATC continues to be the on-site clinic administrator for 2021. Please note that the CareATC on-site clinic is currently closed. However, once City Hall reopens, they will resume support and services. As a reminder, CareATC can provide acute care services, which is simply treatment of common illness and minor injuries. They also can support with chronic disease evaluation, any minor procedures that require wound care, as well as supporting you with your preventive care and comprehensive physical exams. They also provide on-site lab work and EKGs. If you select the Blue Essentials PCP plan or the Blue Choice Copay plan for 2021, your on-site visits at CareATC will be free of charge. This will include all sick and preventive visits. If you enroll in the Blue Choice HSA plan, your preventive care visits will be free to the clinic. However, any sick visits will have a $25 fee associated. Once you've satisfied your annual deductible, your fee for visiting the CareATC clinic will reduce to $5. Once your out-of-pocket maximum is satisfied, your visits to the on-site clinic will be free of charge. To make an appointment with CareATC, simply call 1-800-993-8244 or visit careatc.com. Using the CareATC mobile app is also an option. Connect Diabetes and Cardiovascular Management. The city will continue to offer the Connect support programs for 2021. Connect can support you in managing your diabetes as well as managing your hypertension. If you participate in the Connect program and you are diabetic, you will receive a free glucometer and testing supplies. If you have hypertension, you will receive a free blood pressure cuff monitor. Both clinical management programs include dedicated certified diabetes and cardiovascular coaches to help you manage your conditions. This is all done via a customized mobile map. They also help you with generating a personalized action plan and delivering personalized support to help you balance your lifestyle and your health condition. To talk to a Connect representative today, visit connect.com/City of Dallas. The 2021 Benefit Rewards Program will continue to be simple and offer an amazing reward. There are 3 easy steps for completion. Step 1, complete an online health assessment. Step 2, get an annual physical or age-appropriate screening with your physician. And step 3 is participating in an on-site biometric screening at the City of Dallas. All steps must be completed by active employees enrolled in a city-sponsored medical plan. The wellness period for the 2021 benefit plan year will begin on September 1st of 2020 and conclude on August 31st of 2021. The 3 steps noted above must be completed within this time frame. If completed, you'll earn a wonderful participation reward. That participation reward is an extra $500 on your payroll check for December of 2021. Life and AD&D benefits. The city provides all full-time employees with basic life insurance in the amount of $75,000. If you would like to purchase additional supplemental life insurance for yourself, your spouse, or your child or children, you may do so. You can purchase additional supplemental life insurance for yourself in increments of 1, 2, or 3 times your annual salary, up to a maximum of $500,000. If you'd like to purchase additional life insurance on your spouse, your choices are amounts of $15,000 or $25,000. For your child or children, $5,000 or $10,000 amounts. Please note that you cannot purchase spouse life or child life without first purchasing additional supplemental employee life coverage. If you've previously elected supplemental life, you can increase your amount by 1 increment at this open enrollment period without evidence of insurability. A great opportunity to increase your life insurance amount. We'd also remind you to update your beneficiary information. This should be done annually to ensure that your beneficiary data is correct. Next, we'll look at accidental death and dismemberment, commonly known as AD&D coverage. Voluntary AD&D coverage is available in increments of $25,000 up to $250,000 for an employee. You can purchase AD&D coverage on your spouse or your children at 60% for your spouse and 20% for your child if purchased individually. If you purchase AD&D coverage on both your spouse and your child or children, the amounts are 50% for spouse and 15% for employee coverage. As a reminder, you must have dependent level AD&D to purchase child or spouse AD&D coverage. Now we'll transition to look at other voluntary benefits. Voluntary benefits are available to all City of Dallas to help you offset the expenses that come with accidents, critical illness, or hospitalization. Please note that voluntary benefit amounts are paid directly to you, not to an insurance company and not to providers. These are dollars that go back into your pocket. There are 3 types of voluntary benefit policies available. First is accident insurance. Accident insurance pays you or your covered member if you are involved in a covered accident. It's also important to note that just electing this coverage alone allows you to receive a $75 health screening benefit. So if you complete your wellness activity and you get your annual wellness exam and you enroll in accident insurance, you'll receive a $75 benefit just for completing the health screening. The second type of voluntary benefit available is critical illness. Critical illness pays a cash benefit to you or a covered member if you are diagnosed with a covered critical illness. This includes a cancer diagnosis. It's important to note that the standard has waived pre-existing conditions for the critical illness policy, and this benefit also includes a screening benefit of $50. And yes, if I have accident insurance and critical illness insurance, I'm eligible for both health screening benefits. The third type of voluntary policy is hospital indemnity coverage. Hospital indemnity coverage pays if you are a covered member or hospitalized. There's a guaranteed issue for this place, waived pre-existing conditions, and also a health screening benefit of $50. If you elect all three of these coverage options, all three health screening benefits are payable to you with the completion of an annual health exam. The final two benefits noted on this slide speak to disability protection. Disability insurance provides you with a percentage of your pre-disability income in the event that you are disabled and unable to work for a period of time. Short-term disability provides 60% income replacement, and it is a weekly benefit that's payable for a period of up to 6 months. There's no pre-existing limitations for this coverage. Should you have a disability that prevents you from working longer than 6 months, you may be interested in purchasing long-term disability insurance. Long-term disability insurance also provides you with 60% of income replacement. However, this benefit is paid monthly. There's a 180-day elimination period. Please note the elimination period is typically covered under short-term disability if elected. Long-term disability has a typical payment period of 2 years. We encourage you to review the benefits guide carefully and determine if any of the benefits and if any of the voluntary benefits allowed meet the needs of you or your family. We'll lastly leave you with enrollment reminders. As a reminder, you have two ways to enroll in benefits for the 2021 plan year. You can enroll online by following the link. Remember to enter the site exactly as noted here or in the benefit guide. You may also enroll with a benefit specialist by calling the number shown here on the slide. It is also extremely important that you remember that this is an active enrollment period because of the number of changes that we have. In order for you to have medical, dental, or vision coverage for the 2021 plan year, you must take action during the annual enrollment period. Open enrollment begins on September 14th and ends on September 27th. Please be sure to complete your enrollment during this time. If you are waiving benefits, we'd also like you to contact EBC and note the waive of coverage. If you have general benefit questions, you can always contact the City Hall Benefit Service Center at 214-671-6947 option 1. You can also send an email to hrbenefits@dallascityhall.com. Please complete your open enrollment during the open enrollment time frame and contact EBC with enrollment questions or support, or the benefit helpline for general benefit questions. Thank you for your time.